In today's day and age, the controversy over medical marijuana has been one of the most talked about social medical issues in today's society. Many people view marijuana as having less negative effects as previously thought. For this reason, many people are pushing for it to be medically legal nationwide. Medical marijuana can be used to ease pain and lessen the severity of certain medical problems like cancer, arthritis, and epilepsy. Therefore, in today's special report, we will be interviewing Dr. Wells, and we'll now send it over to Matt Washington, who's sitting in as our guest. Matt?
Thanks, Dalton. I'm here today with cancer specialist Dr. Melanie Wells. First off, doctor, why do you think medical marijuana should be legalized?
Well, Matt, I've had numerous cancer patients who could have suffered less with the use of marijuana added to their treatment to relieve their pain from the chemotherapy. Many doctors feel that this plant can be used as an herbal medicine to help with the patient's pain.
Good to know, doctor, but more specifically speaking, what kinds of symptoms can medical marijuana help relieve?
Medical marijuana can be used to relieve nausea, muscle spasms, and chronic pain, and these are just a few of the symptoms that can be helped.
So what types of illnesses and diseases can marijuana benefit?
Well, to start off, when AIDS and HIV patients undergo treatment, they take multiple medications, and oftentimes there are side effects of nausea and vomiting. Now, because of the use of medical marijuana, patients have a more tolerable treatment.
Thanks, Dr. Wells, and we'll take it back to Dalton in the studio.
Thanks, Matt, and we'll be back after this short message.
Honey, is your glaucoma acting up again?
Yeah.
Good thing we brought your Weedox. Oh, honey, look over there.
It's a bird.
Redox can be used daily. Symptoms may begin to improve in 1 minute. Maximum relief may require increased inhaling. Results may vary. Side effects may include heightened hunger and focused lethargy and are generally favorable. Do not use Redox if you are allergic to ragweed or near anyone who may be pregnant or allergic to ragweed. Redox lets you get back to the things you really love. Ask your healthcare professional if Redox is right for you.
This is what I'm talking about.
And we're back. Thanks, Matt. We're now on the phone with Timbuktu, who has been diagnosed with HIV for 6 months. Thanks for being on the show with us, Tim. So tell us about the last 6 months of your treatment.
Well, Dalton, you see, during my first 4 months of treatment, I was taking multiple pills a day, and I was overwhelmed with nausea, and I vomited around 3 times a week at work. I was so miserable because of these symptoms that I needed immediate relief.
So what did you decide to do, Tim?
I never thought it would happen, but I heard about how marijuana can help relieve nausea, so I decided to try it one day. It ended up working really well for me, so I decided to look into the states where medical marijuana was legal. One of these was California, and it seemed to fit me the best. After around 2 weeks, I decided to move out there, and since then, I've felt a big difference in my life.
That's awesome, Tim. I'm glad to hear you're happy now. So would you suggest this method of treatment to other people with your condition?
Well, Dalton, not everybody deals with these conditions, so it is unnecessary to use medical marijuana if you do not face the negative side effects of HIV medications. But if you decide you are dealing with nausea, I would highly suggest at least giving it a shot.
Thanks for joining us on the show, Tim, and we hope your treatment continues to go well. Thanks, Matt. And now a brief message from our sponsors.
My spine is completely degenerated. I've had 2 major spinal fusions, and it has left me in constant pain. It's ridiculous that I can take the most dangerous pills in the world, but I can't use a plant. When I was in the middle of all these narcotics, I thought my life was over. Many, many times I thought of taking my own life. If it wasn't for cannabis, there's no way I could have gone off these medicines. It's giving me my life back. I am not a criminal. I am sick. Cannabis helps me to survive.
Now we'll head back to Matt and Dr. Wells.
Thanks, Dalton. So, Dr. Wells, we've talked about all the positive effects of medical marijuana. Now, are there any negative side effects that patients can encounter?
Just like all other drugs, people can react in different ways. When overused, one symptom some patients may encounter is paranoia.
And how about any serious health effects like lung illness or cancer or any diseases?
First off, it has been proven that it is impossible to overdose. Second, marijuana has been proven to be less harsh on the lungs than cigarettes, and it can be consumed in the form of baked goods, butter, and even tea.
Very interesting, Dr. Wells. Thank you for coming on the show with us today, and I hope that you continue to spread awareness across the nation as you know so many helpful tips for medical marijuana users. Back to you, Bill.
We thank Dr. Wells again for her time and hope this segment has been helpful in clearing up any common misconceptions along with helping to accurately depict our nation's medical marijuana policies. Thank you and join us next time.